Welcome to the presentation on injury prevention and how it relates to sports massage. There have been many discussions about sports massage and if it can directly impact or prevent injuries. And this is our take on it based on the science and the evidence that we have, and also what we have seen in practice. What we will cover in this online learning. We're going to discuss what injury prevention is and recap on the risk factors of injury that we've discussed in the Factors and Differences online learning. We will identify how sports massage therapists can help support their client who are injured, discuss the benefits of sports massage and injury prevention, and also we're going to touch and learn on how managing exercise load is key to injury prevention. So what is injury prevention? We're going to focus on these 5 main areas, as these are areas that can affect injuries either directly or indirectly. So the first one is managing exercise load, and that's finding that sweet spot for your clients between undertraining and overtraining. Having adequate rest from training, including good sleep hygiene. Managing the risk of direct injuries, so that's related to the areas that they're working in, the equipment, etc., which we're going to recap on in a second. Nutrition is important for injury prevention to ensure good quality tissues, the right amount of energy, and also to help recover after injury, which we will discuss in the nutrition modules. And lastly, sports massage, and how sports massage can help your client understand their body to help potentially prevent indirect injuries. So let's recap on the risk factors of injury. So we have the 2 different types: indirect injuries, which are not caused by an external force. So an example of this would be a fatigue-induced muscle soreness. The next is direct, which has been caused by a blunt force, a direct muscular injury such as a contusion. And direct injuries can be classified as mild or moderate severe and may not require the client to cease activity. So that could just be a graze from the surface or a collision with another player or another runner, as an example. So when it comes to those direct injuries, there's only so much that we can do to help try and prevent those types of injuries, because unfortunately accidents can happen. People may fall over. The weather might not be suitable for the type of exercise that they're doing. So as therapists, there's only so much we can do to help support our clients prevent those types of injuries, because unfortunately those things can happen. And some are completely out of our control. So let's take a look at the sports injury risk profile. It was created in a way to help athletes understand that there are biological and psychological impacts that may have a relationship with the external environmental risks of injury, and how the combination can help reduce risk or increase risk of injuries. It's divided into 2 broad categories: personal and environmental. And by dividing them up into the 2 sections, you can see the interplay between the internal risks and also the external risks. And if we relate it back to the risk factors of injury that we've been discussing in this presentation and previous presentations, then the more direct injuries may be the physical or potentially part of the socio-cultural, and the indirect may be affected by the biological or the psychological sections or factors in the sports injury risk profile. And this has been sectioned off into 4 different areas of sports injury risk. So the first one is biological. So that's such as conditioning, biomechanics, overtraining, fatigue, age, all those types of things. The next is physical. So your weather, your equipment, your facility, all those different hazards, which are more or can affect those more indirect injuries. You've got psychological, so life events, stress, different coping mechanisms, beliefs and attitudes. And then lastly, socio-cultural, so the type of coaching quality, the medical interventions, the rules of the sport, etc. And the main thing to consider when you're looking at the sports injury risk profile is that injuries are often multifactorial. It is very rare, unless it's a direct injury, such as a collision, that something has happened and is only one factor responsible. There potentially could be lots of other factors combined to reduce the risk or increase the risk of injuries in a particular athlete or client. And for this module, we're going to focus specifically on the biological and the psychological risk profile factors. So let's look at the biological. So the first thing I want you to do is a short task. I want you to pause this video and write down how you as a sports massage therapist can help clients with the biological aspects of injury prevention. If we recap some of the factors, they can be conditioning, biomechanics, overtraining, fatigue, maturation, exposure, prior injury, age, all of those biological and internal factors. So when you are ready, pause this video and complete the task. Have you paused it? Well done if you've completed the task, and let's move on to the answers. And here are some of the ways that we can help as sports massage therapists reduce any of the biological risk factors of injury. So the first one is improving range of motion at joints to improve performance. Recommending home care exercises to help work on strength or mobility. Discuss with your client adequate rest and how much they are resting and sleeping. Consider their muscle tone. If there is too much hypertonicity, do we need to reduce that to help improve that range of movement? Are they experiencing pain? Can we help decrease that if there is some potential for fatigue-induced muscle soreness that's arising? We can ask them about their nutrition and how their nutrition is going as part of their training plan, and discuss their training program with them. Now, unless you are qualified in nutrition or in strength and conditioning or personal training, then you can't create a specific training or nutrition plan for your clients. But it gets the conversation started, and you can help pinpoint them to get the right help and support they need. So maybe they need to see a nutritionist or a nutritional therapist or dietitian, or maybe they need to see a strength and conditioning coach or personal trainer to help achieve their goal. Or if they're working in that sporting environment, maybe they need to have specific training with their coaches or their strength and conditioning coaches within their sport. If you're working in private practice, commonly sports massage is often the first go-to when someone wants to help prevent injuries for a particular event, or is experiencing some stiffness, some pain, or potentially a soft tissue injury. And we can help them with those issues, but also the conversation starter about how they can help recover better, how they can help manage their exercise load a little bit more, and then pinpoint them in the right direction. And then next we're going to focus on the psychological factors. So similar to the other task, I want you to pause the video and write down how you as a sports massage therapist can help clients with the psychological aspects of injury prevention. Factors to consider maybe life event stresses, current mood, coping resources, risk-taking, goals, and their beliefs and attitudes. And what it might be helpful for you is you could also recap on the sports massage and psychology module to help answer this task. Before we go into ways that sports massage can help, it's really important to note that we aren't psychologists, we aren't psychotherapists, and we can't suggest certain things to help our clients if you think there is maybe a psychological impact to what is happening in terms of their injury and injury prevention. But what we can do is focus on the things that sports massage can do really well for this psychological aspect of risk factors and injury prevention. And the most important thing for you as a therapist is to ensure that you can refer on if you feel that your client might need some mental health or psychological support. So let's head into the answers. So the first one is decreasing feelings of anxiety and depression. You may recap from level 3 when we talked about the benefits of massage that there's actually quite a bit of research about how massage can help with decreasing of feelings of anxiety and depression. So that's quite a big one. We know that sports massage upregulates the parasympathetic nervous system, so the rest and the digest nervous systems. It has a complete calming effect on the body. And the last is about your presentation as a therapist. Actively listen to your clients, show them that you care and you understand what they are going through. Don't interrupt them when they're trying to tell you their story. Just listen and actively listen in those situations. Be kind, and that's such a simple thing that we can do, showing that you care and being kind to our clients when they are with us in the treatment rooms. And lastly, be helpful. Give them recommendations on what they can do. Give them things that they can do that is positive towards their goal, whether it's their fitness goal or their goal to get out of pain, but support them in that helpful and positive way. And as always, if you aren't sure, always refer on, as that ties in with that helpfulness. So now we've discussed the sports injury risk profile, let's look at sports massage in particular and injury prevention. As we mentioned at the beginning of the presentation, some of the research is positive, some of the research is negative towards how sports massage can help, but let's discuss all of those factors within the next part of the learning. So as we mentioned, the research behind injury prevention doesn't often favour sports massage. But if we start to look at all the evidence we have available to us and we take into consideration this from the physiological benefits, the psychological benefits, we believe that we can have a positive impact on indirect injuries. And when we discuss sports massage and injury prevention, we're not just looking at the techniques themselves, but the whole sports massage treatment, from the initial assessment, the treatment, but also the home care as well. As you know, home care is really, really important. So we're looking at everything. So let's look at some of the reasons and benefits of sports massage for injury prevention. The first one is about supporting clients through issues and injuries such as fatigue-induced muscle soreness. We know sports massage can help with pain reduction. It can improve range of movement, but it also can provide strategies for home care. So that home care section is again really important. In the sports massage treatment, we can assess and treat any imbalances that are causing pain and discomfort. And you know from the posture module is that not all posture equals pain. And we don't always want to work on improving everyone's posture, but when there is pain and discomfort, then it's something that we can do to help, which then may prevent further injuries down the line. And the last one is that sports massage can help reduce that guarding, reduce that protection after an injury or some pain or discomfort, which then can allow a space for adequate loading to occur, so to start to be able to load the tissues. And massage works really well as that relaxation to be able to start creating better movement patterns and movement pathways. So the next one is improving sense of mental well-being. And we know the research is quite strong on how sports massage can help with feelings of anxiety and depression and reducing those feelings and improving an overall sense of well-being. And then that ties in with the stimulation of the parasympathetic nervous system, so that rest and digest nervous system, which is important for rest recovery and also, again, that sense of mental well-being. Another thing to consider when discussing sports massage and injury prevention, as sports massage has the ability to improve sensory feedback within a particular area using touch and the sports massage techniques. If a client is struggling with a certain range of movement, possibly due to some guarding, then what sports massage can do with techniques such as soft tissue release and MET, it can help improve feedback around that particular area and improve that proprioception around the joint, which then can help better range of motion, which then potentially can help reduce the risk of injuries due to restriction in range of motion, as an example. And last is about improving movement patterns. If a client has an improvement in sensory feedback to an area and can help improve that range of movement, then their overall movement patterns will be improved, which then again potentially can help prevent the risk of injuries caused by restriction and range of movement. So let's now take a look at stretching and injury prevention. When it comes to stretching, clients will often say to you, oh, I've not done my stretches after my workout or after my activity, so that's why I'm injured, or is that why I'm injured? And they may be asking you for that advice or support. But what we know is that actually stretching isn't a guaranteed method of injury prevention. So let's just look at a little bit of the research behind that. Some of the research that we found showed that within lower intensity activities like jogging and cycling, static stretching pre-workout did not reduce any injury levels whatsoever. So it wasn't a surefire way of preventing injury. Some of the research showed that in the higher intense activities such as high jumping, static stretching created more of an impact on injury prevention, but that study was fairly small. So when you're working with your clients, most likely they will be taking part in more of the lower intensity activities like jogging, cycling, playing sport, etc., rather than that kind of high intense athletic level of high jumping as an example. So we can then suggest that actually static stretching before their workout may not be the best thing for them to prevent injuries. But on the flip side of that, although injury rates didn't decrease with static stretching, they didn't increase either. And if you are working with clients that love static stretching before they exercise and it makes them feel really good, then I would suggest for them to not change their current routine. Because if it's working for them, it's working for them. And the research behind it doesn't suggest that it's going to increase the rates of injury. But on the other side, if you've got clients that are really worried about missing their static stretching pre-workout, then you can educate them and tell them that actually they don't need to do that static stretching before they go into exercise. And maybe some dynamic movement that is more relatable to the sport they're about to do will be more beneficial for them. A few months ago, Pentony and I ran a webinar based on the myths of stretching. So I will add that into the learning also, so you have that for further reading on stretching and injury prevention. And the final section of this learning is looking at managing exercise load and injury prevention. Now, this is really key for us to understand as sports massage therapists, because managing the load has a big impact on injuries or injury prevention and risk of injuries. So let's take a look at what we need to know as sports massage therapists and how we can help. Managing exercise load is about that fine balance between undertraining and overtraining. Now, in your clinics already, you may experience clients that come into you and say they're training 6 or 7 days a week for a few hours a day, and they're struggling with potentially a fatigue-induced muscle soreness, or they've built up and experienced tendinopathies and things like that, but they're continuing to overtrain. Or they could be the other end of the spectrum where they aren't training and then they're completely sedentary, they're not exercising, and they're also experiencing certain soft tissue injuries or dysfunctions based on the low level of activity they are doing. Now, this is a really big topic, and for us, we haven't got to worry about trying to prescribe with them levels of training that's going to be suitable for them, because that's what their strength and conditioning coach, their personal trainer is designed to do. But what we can do is have that chat with them about their levels of training, and actually that may be impacting what they've been experiencing. The acute chronic workload ratio was created as a way to manage training load for athletes, as athletes are often exposed to high intensity training sessions or training loads, weeks or months, lots of competitions between that, and then often short rest periods. And as we know, research also suggests that poorly managed training can increase the risk of injury. So this ratio was a way of helping manage a client's athlete's training load by looking at the training load on a short and long-term basis, alongside the history, to create a really good periodization plan to reduce the risk of injury. Now, for the everyday client, this ratio will not be relevant. But it's a lot more useful if you're working with an athlete to chat with their strength and conditioning coach, their performance coach, about their load if you're worried about the risk of injury. So the ratio itself is created between the training load within a short-term 7-day period against a longer workload period, often around the 28-day period, and then the ratio number is created. And this figure will give you a prediction of whether the training load may be deemed as it's undertraining the athlete, it's an optimal level of training for the athlete, or it's overtraining the athlete, which then can determine the risk of injury that the athlete may be exposed to. And then you can use the ratio to plot a chart to find out where the sweet spot is for reducing that risk of injury, or where the injury risk is the lowest for that particular athlete. And as you can see on this graph, as the ratio increases, the risk of injury also increases. But as you go down to where the workload is at its lowest, where there's a level of undertraining, then again that risk of injury also increases because the level of fitness is at its lowest. The best way to play around with it is to try using the acute chronic workload ratio against your own level of training, so you can see where your risk of injury is at its lowest and also at its highest. And within the online learning, I will put some links so you can find a bit more about this ratio to try it out on yourself and then discuss it with your clients in more detail. So how do we integrate the acute chronic workload ratio into our sports massage appointments? Well, we don't need to work out the ratio for our clients. That's not our job. But what we can do is, if you're working with athletes especially, chat with their coaches about that acute chronic workload. If you think an athlete is demonstrating signs of fatigue or you think their risk of injury is higher. If you have clients that are athletes but are recreational athletes but also train quite hard for competitions, then you might find some of them would love the ratio. I often find athletes such as cyclists and long distance runners, they really like this stuff because it helps them manage their training if they're training for any particular event or competition. So you can send them the information for the ratio so they can work their own ratio out, especially if they manage their own training. And for those clients that are recreational athletes, or do they just train at that low level intensity a few times a week, or they're more sedentary, the acute chronic workload ratio wouldn't be beneficial for them. It wouldn't make sense. But what you can do is chat with them about that balance between undertraining and overtraining so they can help themselves reduce that risk of injury. So if there's someone who's going to the gym 5 or 6 times a week and they're showing signs of fatigue or they have had an injury, then chat with them about this. And then the same thing if you've got clients that aren't moving and exercising at all, then again, it's the other end of the spectrum, the level of fitness at its lowest, they're more likely to become injured. So let's recap on what we've learned in this online learning today. We've discussed what injury prevention is and recapped on the risk factors of injury. We've identified how sports massage therapists can help support their clients who are injured. We've discussed the benefits of sports massage and injury prevention. But we've also discussed about how managing exercise load is the big key to injury prevention, which often many sports massage therapists don't really discuss with their clients. And I think for you now going forward, have a chat with your clients if you think that they may be not training enough, training too much, to help them reduce the risk of injuries so they can carry on training for longer and for higher intensities. And here are some references that we've used as part of this presentation. So I would suggest that you spend some time going through some of these references to improve and increase your learning in this area, as it's a really important area within sports massage.